Hey guys, it's Joel with Taproot Therapy, and this video is on what it feels like and looks like on your end and on mine, or on the therapist's end and on the client's end, to get brain spotting. That's one of the most common questions that we get, is what exactly is brain spotting? You're kind of talking about this theoretical trauma stuff, with trauma being a stuck memory and eye position and a vasovagal reaction, but what does it look like to actually get the therapy? So I'm going to show you, for what looks like the first time on the internet, at least I couldn't find one, what brain spotting looks like in the eye. When you find a brain spot, what it looks like and what it does. And also what it looks like as a patient when you're getting brain spotting in therapy. Brain spotting, if you're not familiar, is the fastest and most effective trauma treatment tool that I've ever found. I use many modalities of trauma therapy, of psychotherapy. I really love to read a little bit of everything, you know, going back to the founding fathers of psychotherapy, Freud, Jung, and Adler. And Otto von Rank, I like to suck all that stuff up and figure out what works and who had what idea and how it fits together. And brain spotting is a pretty revolutionary thing. It did wonders for me as a patient in therapy, whereas a lot of things that, even the things that I use, like EMDR, really didn't do that much for me. I've never seen it not be effective. On some level. So to jump into what it looks like to get psychotherapy, so the first thing is, I'll be on a swivelly stool that kind of rolls around like this, and that's so that when you're sitting right there where you are as a patient on the therapy couch, I can get my pointer and I can be able to see your eye and what it's doing. Sometimes in brain spotting, you're going based on what you feel as a patient, and sometimes you're going based on what I see happening to your eye as I move it in order to find where the brain spots are. So it's a pretty simple procedure. I have a pointer and you follow it with your eye. You want to be able to keep your head still, at least while we're finding the brain spot, because if you're doing this, then you're moving your head, you're not moving your eye. I want to move your eye. I move the pointer, and I look at what your eye's doing, or ask you what you feel, and we check in with the body and we start to map out body reactions, where they're happening. There's a lot of different techniques for brain spotting. Sometimes you're going to be finding a spot that is very activating, that makes your kind of fight or flight system rev up. Other times you're finding a spot that sucks the anxiety out of you and really calms it, depending on what you're doing. Sometimes you will listen to music on headphones. That's similar to, if you've ever done EMDR as a patient or a therapist, the kind of beeping headphones that help with the bilateral stimulation. There's some tracks of music that we have for brain spotting. We don't always use them. Some of it's like classical guitar, and some of it's like seagulls on a beach. It doesn't really matter what the music is. But what is effective about it is the tracks on the music are going back and forth between each ear like this. And they're going back and forth in a way that is not predictable to your brain. So your brain's having to kind of fire up the creative part, the creative half of it, to put that back together and understand what's going on, and being like, oh, that's the same sound that I'm hearing, but now it's over here. Something about that process sometimes makes you go further into processing, sometimes not. Some people use them a lot. And then occasionally you'll use our glasses that have one eye covered. There's another set too, and have the other eye covered. And when we're doing certain kinds of brain spotting, you'll just have one eye that we're looking at. And sometimes that can speed up, make the processing more intense, or it can slow it down and make the processing a little bit more calm. If there's an issue with panic or dissociation, that lets you treat people that have a much stronger kind of symptom reaction. So as far as being a patient, this is about what brain spotting looks like. So let's jump into it. I'm going to show you one of the spots that I've been working on with a brain spotting therapist for myself as a patient, and I'll show you one of the spots that kind of reacts to me. Now keep in mind, it's not going to be the biggest. I've had a lot of processing over the last year, and a lot of talk therapy over my lifetime. I don't believe that you really should do a modality of therapy until you've been in that kind of therapy. So I've been in a lot of kinds of therapy because I do a lot of them. And so this spot's not going to be as reactive as some of them. I mean, some brain spots you see the pupil go from being about this big to about that big, where there's almost no iris left around the eye at all, and then it is just going crazy. My eye's not going to do that. It may have a while ago. But you will be able to tell that there's a spot where all of a sudden the dilation changes every time I hit that spot, and that's a spot that's very reactive. And it has nothing to do with the amount of light in the room. I mean, you can see here we have the windows open, the lamps are pretty dim, but the amount of light in this room is consistent. So when I'm moving the pointer and you're looking at my eye, there's no kind of light source that's going to be changing. I mean, the light from the camera is pretty bright, so my eye kind of wants to be small. There's no reason for, when I'm looking at the spotlight, for my eye to really be trying to open up, because I'm looking at a pretty bright light the whole time. So when it's opening up, it's because there's a spot there. So we'll jump into that, and I'll show you what it looks like to find a brain spot.
Alright, so I'm looking around right now. You can see my pupil is kind of reacting to the light and staying small. It's dilating here. I kind of feel a little bit of a spot, but it feels more like a resource spot to me. And I'm looking for an activation spot where I can really process. So the one that I feel, you can see my eyes swelling when it's kind of about at this position. And so I start noticing that my back is getting tight and that all the muscles on my lower back are kind of opening and closing. And that's what I'm feeling right now. You can see that my eyes starting to go into processing. And as I was processing right here, what I felt was that my back got really tight, it opened up, and then right when you see my eye bloom right there, I felt everything go up into my upper back. My upper back got tight and kind of hurt. And then really deep in processing, it kind of relaxes. So I've got my head right real close to a light. It's awkward. It doesn't feel very good. It's not the most ideal, comfortable situation. But right here, you could tell that I'm deep in processing. My eyes starting to be really reactive. And what was going on in my head was that I couldn't really think anymore. In words, I just had a really deep awareness of my body. And I felt a ball of light, that had been making my back tight, kind of let go, the tension let go and moved up into behind my eyes and my forehead. I felt kind of like a migraine pain that got real sharp, and then it starts to let go right about here. So at about this point, I no longer have any strong somatic movements that I feel. I just have a kind of deep awareness of my body. I felt really sleepy. I felt kind of a deep emotional state, maybe like a sad contentedness, just kind of happy and present, but also a little melancholy. A lot of the emotional feelings you get when you go deep into the subcortical brain with brain spotting don't always fit neatly into words. I remember kind of blinking a lot and just feeling my entire body and this kind of like a happiness that I was here, but also just kind of a melancholy that it's hard to hold on to the present moment, something like that. Your thinky brain kind of turns off a lot of the times with brain spotting, so I wasn't really thinking in words. I was just kind of feeling a deep kind of subcortical experience. It's not uncommon with brain spotting to just kind of feel a deep emotional and body awareness without words, really. It looks different for everybody, but that is something that happens often. And so that's kind of just what I felt there. So remember, the whole time that you're watching my eye swell to that size, I am staring at a huge ring of LED light that's putting out a whole lot of bright watts in my eye. Like, my eye's natural reaction is to shrink away and get small and dilate. So my eye is pulsating and opening here because I'm on a brain spot. If I was to kind of look down like you saw in the beginning, my eye would just shrink to a teeny tiny aperture. And that was the video. I hope that was interesting. A lot of people have asked what brain spotting looks like, even after they've done it in therapy with me. They want to know what their eye was doing. What is it that I'm seeing? So hopefully that gives you kind of an idea there. I'm honestly better at seeing them from the outside than I am for feeling where my own are. And so I'm kind of frustrated that I wasn't right on that. Watching the video, I'm realizing, well, if I had my pointer and I was doing brain spotting on that eye, I would have been able to maybe scoot it over a little bit better, a little bit to the left, and go deeper into processing. But you can get the idea, and hopefully that was interesting. If you have any questions, give me a comment, and I hope that everybody is able to check out this amazing kind of therapy, because even if you just got a little general kind of higher anxiety baseline, I've still found it to be extremely helpful. Thanks.